Okay, I feel like I get a examination in front of my teacher, Dr. Saw, but as you learned from this morning session and afternoon session, hypoplastic left heart syndrome is very rare, and especially in Korea, because Dr. John reviewed already the total national registry number, over 1,100 cases. Congenital or pediatric transplant cases may be less than 100 cases. And among them, major diagnosis must be, even in pediatric cases, cardiomyopathy. But congenital defect cases are rare, and hypoplastic left heart syndrome is especially rare in Korea because the total instance of hypoplastic left heart syndrome is quite low compared to North America. This case is very interesting. The 3-year-old girl was transferred to me because heart failure after fontan operation due to hypoplastic left heart syndrome. You see here, simple chest film showed a battlefield. So many something, and pacemakers and dilated heart. She underwent no operation at day 5 with the tricuspid valvuloplasty. Maybe severe TR was happened there at the time. And in due procedure, after 6 months old, bidirectional cable pulmonary shunt was performed, and 2 years later, extracardiac fontan operation was performed, and again with tricuspid valvuloplasty. And 2 months later, complete heart block occurred, so permanent pacemaker was inserted. And 5 months later, this patient visited me due to congestive heart failure. This is pre-op echo in this patient. The end-diastolic dimension was 54 millimeter, and the systolic dimension was 47. It's funny that this small hypoplastic morphologic left ventricle is just working, but big right ventricle is not working at all. Yes, there is. We can observe that some mild degree of valve requestation. Strain was very low, and pre-transplant lab was performed, but BNP was only elevated, but creatinine was normal, otherwise normal. And ABI was B+, and other labs were not abnormal. During the patient listing and workup period, 7th hospital day, even under dopamine and Mylinone infusion, cardiac arrest occurred. So during CPCR, we put VA ECMO. This is not the Javik or sunshine heart, just ordinary cardiopulmonary bypass, because in Korea, those modality is not available now. Okay. You look here. This is arterial cannula through carotid artery, and this is venous cannula through SVC to pulmonary artery. Yes, we did transplantation. This is post 1 day. Still cardiomegaly, big heart compared to pre-op, because recipient was a 3-year-old girl and body weight was 12 and body surface was 0.5. But the donor was a 27-year-old girl, lady, 52 kilogram, body surface was 1.56. So size mismatch was quite significant. But she was fortunate because after 10 days ECMO support, this donor appeared. Although the size mismatching was significant, but we did the transplant. The ischemic time was 2.5. This is post-op 5th day after extubation, and this is 2 months later. You see the big donor heart is smaller than before. This slide shows the big donor heart remodeling according to the time course. 1 month after operation, LV dimension, G value was diastolic 2.9, systolic 1.4. At 2 months after operation, 0.7. At 3 months after operation is near normal, almost normal. And after then, the donor heart very closely correlate to somatic growth. This echo showed after 1 month of cardiac function, looks normal, ejection fraction 77%, LV dimension was 37. This is larger than his body size, but decreased. This echo shows that after 3 months of transplantation, quite good. And after 1 year, some LVH because maybe related to hypertension or something. Regarding to the immunosuppression, we did the triple regimen. PD only gave for 3 months. We experienced complications during early post-op time. As we expect, Beaker syndrome. After transplantation, systolic BP increased up to 150. So we have to cover several kinds of medicine. But so after almost 2 weeks later, blood pressure was stable. Another problem was that suspicious hypertensive encephalopathy because the hypertension, we worried about these problems because after even extubation, she didn't respond to our stimulation or discussion talk. And by EEG, report was showed that diffuse cerebral dysfunction, but luckily, brain MR study showed normal, and her cognitive disorder and other function returned to normal. As late complications, up to 3 years, early period of EB virus infection, no rejection, no other complications, but after 11 months operation, she suffered from anemia, vomiting, diarrhea, a kind of GI syndrome, so symptoms. So we did endoscopic biopsy, and it showed that PTLD, so-called lymphoma. Yes, this is the case presentation.